There were things that came up during my MDMA session that I was very comfortable talking about that I had never talked about with my therapist or never gotten close to. I'd gotten maybe taken a few steps towards it, but it was so uncomfortable that I would want to break the door down and get out of the room. But before I broke the door down, I would want to destroy everything in the room. That's the feeling that I had. I never did that, but that's what it felt like on the inside when this thing would start to try to claw its way out of me. And this was so different. And so I would come to a realization when I was inside of the medicine. And I'm not sure what the timeline was. Time is slowed down, if you will. I would come to a realization or have an aha moment, and I would want to talk to my therapist about it, my clinicians that were there with me. And it was incredible. I would take the eye shades off, the headphones, like, oh, this thing just happened. Or I just thought about this thing or witnessed this thing in my mind, and here's what I think about it now, and this is the understanding that I have about it. And I'd want to talk about it, so I would talk to them about it. They would take notes, maybe ask some questions, but the interaction was pretty, I want to call it hands-off. They were really letting the medicine do what it's so good at doing, and they are so good at guiding these treatments.